This is our third International Prostate Cancer Symposium. Please welcome Peter Scardino.
I'm going to give you my perspective on some issues in early stage clinically localized prostate cancer and some thoughts about where we are, where we can go next, and what I see as the future.
This program has been put together by my team, but most importantly by my right hand, Dr. Ketan Badani, who has really been the force behind putting this entire program.
And then the first step, and there's two options here, you can either go to the seminal vesicle dissection first via posterior approach, or you can go through the bladder neck.
So Dr. Olaf Eckert, please come up. You're going to talk about epidemiology of prostate cancer.
When you take a cohort of men without prostate cancer and check their PSA prevalence, PSA testing prevalence, it's in the ages of 70 when it peaks. Around the 2-year prevalence is around 40-50%.
If you step back and look at an overview of prostate cancer in the United States, there's obviously been a huge increase in incidence with the application of PSA testing.
Prostate cancer is most common in Northern and Western Europe, in South America, Brazil mainly, and in North America with USA and Australia and South Africa.
I'd like to introduce the next speaker, Dr. Jim Hu, who's going to talk about the task force and how they've hurt cancer screening.
So looking at the epidemiology of prostate cancer, I think the most interesting contrast that I'll paint is that we know that the peak incidence of prostate cancer was 230,000, and that's when annual PSA screening was very prevalent. And we note that the training of primary care physicians is important because they're really on the front lines in conveying the importance of this test. Thank you for your attention.